The answer, we really want to do everything we possibly can to encourage an effective and strategic response to the pandemic, and as I said before, for the world to emerge a better and stronger place. So now I'd like to go through my assessment. I'm looking again at the numbers throughout the world, knowing that testing is incomplete, but seeing that still there are rising numbers of cases, particularly in South Asia, in India, Bangladesh, Pakistan to a lesser extent, Indonesia, Nepal. And that is really becoming one of the areas where growth is most rapid. Growth of the pandemic is also rapid in Latin America and parts of the United States, and it's growing but perhaps a bit slower in Africa and in some of the humanitarian hotspots in the Middle East, being described as a slow burn but a corrosive burn in humanitarian settings as the virus just makes its way through communities, causing incredible distress. So how do I view it when I'm describing it to other people? Well, it's not just one big disease explosion. It's a lot of small outbreaks at varying stages of evolution. Most of them are really quite small in their own right, but added together, they become one giant pandemic with, at the moment, 1 million new cases being reported to the World Health Organization about every 5 or 6 days. That's an incredible increase in speed compared with what was happening earlier this year. I mean, it took between January and April to get the first million, and now we've got 1 million in 6 days. So I want to be clear that this is still advancing around the world very rapidly. It's a condition that's not just a mild flu-like illness. In fact, more and more evidence, and even this week I've seen a lot of it, reminding us that around 5% of people have a really long-standing and difficult illness. And I also have read that the guidance from a number of medical authorities now is that if you've got this long tail COVID and you're still unwell some weeks after your initial illness, don't push yourself. Don't exercise hard. Don't force yourself to go back to work. Don't force yourself to concentrate. You actually do need to give yourself the space to get through this, because things are not right inside your own body. And as I say, that's at least 5% of people who have the disease, including quite a lot of younger people. All over the world, we've got communities anxious about what to do about schools, because schools will be restarting and are restarting at this time, with parents anxious, understandably, about their children, and governments anxious because they don't want to keep schools closed, but at the same time, they're nervous that schools could become centers for illness. And we've got many, many reports now of places where there are outbreaks emerging in factories, particularly factories where things are done cold. So you've got the New Zealand outbreaks linked to a cold plant. We've got several of the outbreaks in the UK in cold places, sandwich manufacturing in the Midlands of the UK, and the continued problem of outbreaks in meat and fish and vegetable processing. And getting on top of this and trying to make certain that each outbreak can be handled properly, I'll be talking about in a few minutes. But let me start with some of the core strategic principles that are so important for ensuring that everybody gets on top of this. Each one of these is important. It's a comprehensive package. Now, the first relates to the universal precautions that each individual should take, wearing face protection and making sure that face protection is well fitting, Some people are now saying combine a surgical mask with a cloth mask routinely so that you get the best of both. And they're saying do wear your mask as often as possible because really we're seeing more and more evidence that it does spread, particularly in confined and poorly ventilated locations, potentially quite long distances, even beyond the 2 meters. And then the physical distancing must be there, and trying to maintain that together with hygiene and the cough etiquette, plus regular hand hygiene, self-isolating. When you've got symptoms, you really should not be going around and about when you do have symptoms. All these personal behaviors so important, and I'm moving towards wanting to say that these have just have got to be universal and automatic. I'm going to be more and more focused on the importance of local responses, bringing people together for effective local multi-actor responses with well-functioning public health services to find cases and interrupt transmission, to find contacts and isolate both cases and contacts, and then suppress outbreaks promptly as soon as you've got a sign of them with localized movement restrictions. Try not to use the term lockdown and try to do everything possible to avoid lockdowns, but instead do very effective local level response and containment and keep things going as much as possible with movement restrictions, yes, in a local area when it's necessary. And this will become the new norm. Obviously, there will be some anxiety when you've got quite a lot of transmission in one area. You will be wanting to reduce movement from that area, and other places may want to restrict movement of people from that area coming to their own populations. There's going to be quite a lot of I think, messiness on that, because really there's still a lack of agreement on what does constitute the right way to measure a response. I'm going to say to governments, do everything you can to keep your health services going. Keep your essential health services for non-COVID conditions going. Don't shut everything down because of COVID, because the possibility that lots of people will suffer and die because they can't access reproductive health care or child health care or care for cancer or care for non-communicable diseases is just too great. We've got to be smart enough to keep non-COVID healthcare going and to protect health workers properly. And that means having proper testing regimes for health and other care personnel, and making certain that what goes on in residential care for disabled people or for older people is done safely. We're going to, I think, need to put a lot more emphasis in clear communication of narratives that's consistent and not surrounded by a lot of uncertainty and divisiveness. And I'm going to again put a lot of effort on communications and the significance of clear communications, and just giving people a clear line so that they're not always saying, oh, well, I get one story from one local authority, another story from my business, another story from this political party. We've just got to get the communication right. And then on the strategy, lastly, I'm really keen that we get metrics that are widely understood for assessing responses. And our colleagues in Singapore, Dale Fisher and YY Tang, have been coming up with what they call a 7-item dashboard for assessing COVID readiness, 7 indicators of how well a country is doing. And it's just been put into an infographic by the Straits Times, the Singapore newspaper, but it's really helpful. And I will make certain that if you're on our if you're on our mailing list, that we can send you details of where this is published. It's in the commentary in the Lancet of 2 weeks ago by primary author Fisher. Let me just dig into what I think is necessary in dealing with these local outbreaks. Let's start with Victoria in Australia, where there's been quite a difficult outbreak that started with a group of people in residential areas and has now gone into long-term accommodation for older people right throughout the state. out of around 700 residential care facilities, more than 100 have got intense COVID. That means that staff have to be absent because they're quarantining, and that creates huge problems for care of the people because they just can't get the basic services they need. It's a really difficult situation, and there are many different groups involved from state and central government, and you realize just how challenging it is to work at local level dealing with an expanding outbreak. Or there recent outbreaks I just referred to in the UK in the food sector. Again, difficult because you find that there are workers who are testing positive, but then you have to look at where they live and who they interact with, and also how they're getting to work, and then what they're doing when they leave work. Are they having social events? Are they religious events? And so dissecting out all these issues is really, really difficult. I was looking at some reports from the Ukraine, where the government is looking in Kiev and in other cities and finding that healthcare workers are affected a lot by COVID, but also they have home lives and their families are also being affected. And then if they have social interactions, that's also moving on. And of course, as soon as you start going down to the local level, there are lots of different jurisdictions that are responsible for making sure that things happen. And so together with John, I was thinking yesterday, if I was sharing with others how do you deal with a local response, what would my 5 key points be? The first one is you've got to be a detective. Work out what's going on. Try to establish the pattern of disease and think hard about who is involved and how they're all connected. Because thinking through transmission and trying to work out how transmission has happened and who's been involved in it is all about looking at connections between people. So that's the first thing, you're a connection detective. Secondly, you're a bit of a cluster buster. What you've got to be thinking through is, okay, so I'm looking at this pattern of infection. How can I actually help to reduce the chance of infection? Of course, without stigmatizing the people involved, really important that, but at the same time, helping them to reduce transmission. So I've got to have them on side, and I've got to be thinking through with them, so that means involving them in the discussion, what will break the pattern. Florence and I have been talking with some of the people in meat factories, and we recently visited a meat plant in the Midlands of the UK, and we were able to really learn a lot from the directors of that meat plant, because they said, we involved our employees at all times in working out how best to break the clusters. We couldn't do it without them. It had to be a joint operation. Third one, if you are working at local level, you've got to be a convener. You've got to bring everybody together and use all resources. You don't leave somebody out just because they're not your best friend or they belong to a different political party or a different religion. All responses. You've got to link together the national and the local. You've got to bring the companies, the mosque and the church, community organizations, as well as local authorities. Everybody, all as a group, as a kind of coalition, and you convene them together, actually making a habit of creating a very large group and involving them all and leaving nobody out is the only way to do this. Fourthly, work hard on the connections and on the interfaces. Quite often, when you're trying to deal with people at local level, you find that there are long-standing divisions that have existed for a long time between different hospital groups or between different companies or religious divisions, and of course, always political divisions as well. So actually making a real habit of trying to build the connections and work at the interfaces is absolutely key. How often have we said on these briefings that things go wrong when people don't talk to each other, when people find it impossible to work together. And then the fifth point in this thinking about local responses is see people as the solution and the virus as the problem. Never see people as the problem. That was what we learned in Ebola. That's what we're learning in, for example, in a Dharavi slum in Mumbai. It's what's being learned in the townships in South Africa. It's what's being learned in the favelas in Chile, that actually engaging with the people and having them as the solution makes all the difference. And if you're using the army or the police, it's fine, you actually have to. But again, we learned from Kenya that the police become friend of the people on this and they help them out. And it makes such a difference. That I think is something that we can continue to work on and really support them as they do this. So these are these 5 ideas for an adaptive response that we've been thinking about, and I'd love to know whether they make sense to you. First of all, be a detective and work out the pattern. Secondly, be a cluster buster and work with the people to think through what can break the pattern. Thirdly, convene everybody to work in a coalition so that you've got a multi-actor group working on it. Fourthly, really work on connections and interfaces to make certain that you're really undoing the blockages. And then fifthly, at all times, remember that the virus is the problem and the people are the solution, and it's no other way. I want to move to another key point that I'm working on, which is on access to the things that really matter. Access to personal protective equipment for health workers, access to medicines and to the necessary treatment equipment like ventilators and oxygen, access to diagnostics. I'm hearing so much about countries where there's insufficient reagents for PCR testing, access to new tests that can be very quick. We keep hearing about them. They make such a difference. Access to treatments that work and not having them all hidden away, and developing new and effective treatments, because that's what really matters to people, is avoiding suffering and death. And then access to vaccines as they come on board, and trying to avoid this business where different countries and communities fight like anything to get a vaccine and then just to keep it for their people. Our friend Bruce Aylward at the World Health Organization is leading something called the ACT Accelerator, which is a way of trying to ensure equitable access. And there is a major initiative on access to vaccines that's been brought together by a group of entities. And I want to be able to brief you on this as it evolves, but I want you to be very clear in your communications. It's no good having the essential elements available just for a small number of wealthy people. We must work on equitable access, and that's a global challenge. And then my next heading is the need for a global strategy to help the world get ahead of COVID. A global strategy that everybody can tune into. What would be my key elements of this global strategy? Well, many of the things I've talked about just today. Universal precautions by everybody. That means masking, physical distancing, hygiene. It means everybody doing it and being responsible about it. I know we see more and more reports of people getting beaten up when they accost individuals who are not wearing masks. We've got to move away from that, and it's just got to become the norm, like wearing a seatbelt or wearing a crash helmet if you're riding on the back of a motorbike or even on the front. Secondly, on the global strategy is keeping this emphasis on local public health responses that involve everybody, that adapt in a way that does the things that I just described. Thirdly, keeping essential healthcare going so that we don't have people unable to access healthcare because of COVID. And fourthly, having these dashboards that help to indicate whether or not a country or a community is responding adequately, dashboards that are publicly available, and then this important issue of equity on access to diagnosis, treatment, and vaccine. So just revising some of the points that I've just said, I want to share with you, and this is in what will be emerging as the narrative of this week on our website, and it's a lot in it, and I'll keep coming back to it again and again and again. Start at the beginning. Remember, COVID pandemic is a series of outbreaks, and they're going to go on happening for the foreseeable future. And it is up to us as a society to get on top of these outbreaks. And we must remember that these outbreaks are particularly hitting poor people and poor countries and hurting them. And therefore, we have to have a poverty focus. And these outbreaks are mostly people with symptoms, but there is, according to recent work published from the UK, there is evidence that there is possibly a fair amount of asymptomatic presence as well. Something called the REACT-2 study just published by my colleague Aradazi and other people, collaborators that he's working with, suggesting that in London, around 10% of people actually have antibodies to COVID. So there is asymptomatic spread. So we need to have this basic view in our mind. There's some asymptomatic spread, but there are basically just constant outbreaks going on and on and on, and we have to be able to deal with them. So that's number one. That was my first opening point. Then I went down through a set of strategic principles that I laid out that I believe are applicable everywhere. And I said how important it is that we are all able to talk about these strategic principles. Then I said, well, what would I say to somebody who's dealing with a response at local level? And then I was talking about some of the spikes that we're seeing around the world. And I came out with these 5 things that you need to do, starting with being a detective and then being a cluster buster and that sort of stuff, bringing everybody together. And then the 4th thing I talked about was how vital it is that we get equitable access to protective equipment and to medicines and to every other element that we need to deal with this problem, and how much I want to go on fighting for that, and how much we need the World Health Organization pushing for that. And then the 5th thing is I said the world does need a unified strategy for COVID-19 readiness and response. And I'll just say that that needs to be a very clear, and I suggested a 5-point strategy, and that needs to be broadcast everywhere because this problem is not going to go away. Well, we're going to now have the interactive session of this briefing, and we're going to continue, as I said, with this second series of briefings, very much focusing on what's happening and responses, and then giving space to all of you. And the reason why I'm really keen to do this is that I'm personally convinced, and I'm coming across many others who are convinced, that any one of us who has the ability to connect with others and to lead on this issue really has to do so. And that's because the world leadership system is just not responding to the magnitude of this global challenge. And so you'll hear me talking like this. And I know that, you know, I don't have an institution to lead, and people who are leading institutions are very cramped because the political space in which they operate is so contested. But this has to be a people's movement throughout the world. And all of us need to be working together to stimulate that. And we've just got to go on and on and on, wherever we can. And there are folk listening, and they're listening in many different places. And sometimes we don't know who's listening, but they're picking it up, because more and more people are realizing that without collective action, clear strategies, leadership, we will not be able to pull through this without huge long-term consequences for everybody. So Peter Morey, you've done a display. Hope it wasn't too much stuff and too complicated. Gosh, yes, I can see it there. Beautifully, beautifully done. And thank you. I can see you've managed to hold on and get some of the main points that I was trying to get in there. Very grateful to you, like it. And thanks for giving big emphasis to equity, and also for illustrating some of the issues we talked about, food factories, schools, the long tail issue. Thank you. Thank you very much indeed. Let's now come to some of the questions that we've had. Just like to acknowledge that we've got the team on from 4SD, and if members of the team want to make comments, please do so. Very much want to I'll give a shout out to them. Here's the results of the poll. Twee, would you like to just tell us what you've noted from the poll? This is Twee, our communications lead. Come in, Twee.
Hi everyone. So thank you for completing the poll. It's a nice way for us to interact and feel the mood of the people here, which is something we miss when we're having virtual meetings. So thank you very much. We can see we have many people here joining from Europe, but also a few from East Asia, Africa, Middle East, North Africa, and North America. So welcome to everyone. The age range is a nice spread across all the different age groups except for the under 30s. And then lastly, my personal favorite is, how are you all feeling today? So we've got a lot of you saying on the more positive end of the spectrum, and mostly the response was on optimism and hopeful. And then we have a few who are feeling overwhelmed with doubt, worry, and blame. So thoughts with all of you as we get through this, but a very, very nice way to feel the mood in the room. So thank you to all.
Thank you. We're so grateful to you. And so, as well as Twee on from the team, we have Catherine Deland. Hello, Catherine. Catherine works on all the tricky health issues. We've got John Atkinson, who's our systems leader, guru, and it was John who was really helping yesterday with thinking through what are the characteristics of local action that we need to be able to name and then debate. And then Florence Lasven, who is the managing director of 4SD, who's sitting next to me and is helping make sure that everybody is connected. I can't see everybody's names, and in fact it's not necessarily a brilliant idea, but I do want to give a shout out to Mike Sandys, with whom I had a conversation quite recently. Mike is, I'm assuming it is the same Mike.
It is indeed, David, yes.
Director of Public Health in Leicester. And in a minute, Mike, as soon as I finish this piece of speaking, I'd just like to invite you to make any off-the-cuff remarks, because you have had to disentangle a really difficult cluster, and you are still dealing with the issues in your area. And then I'd just also like to really give a shout out to Vicky Doyle, Vicky, who works with Nazim, who, as you know, is this brilliant Gambian singer who produced the COVID-ready anthem. And there's Vicky wearing shades. Thank you. I only said that to help others identify you quickly. Vicky is, do you just want to say just one word before I go to Mike about Nazim's latest song?
Okay, thanks, David. Yes, Nazim's just released his latest song called Be Kind, which is very much trying to tackle the issues of equity and vulnerability, particularly amongst women, children and adolescents. So the audio version has just been released. We're going to be doing the video over the next couple of weeks. And so as normal, we try and have a one world response. So we've put a call out for people to send in short video clips or photos of acts of kindness and also of depicting women in everyday life. So I've sent an email to you and to Twee, so maybe you could help publicise our call as well. Video will be shot in location in Gambia, but we will be incorporating clips globally. So thanks, David.
Ricky. And Twee's put the link to the soundtrack of Be Kind on the chat, so enjoy. Mike Sanders, thank you very much for joining us. I'd just like to give you a moment, 3 or 4 minutes, just to reflect on anything that's going on, and particularly anything I said that might be relevant to what you're doing.
Yeah, so apologies for joining late, but I sort of picked up the characteristics and the end of your talk there. Really liking the characteristics, but I guess it's how we all work together in that manner, particularly when we're up against sort of national government policy. So being a detective, investigating clusters, all the 5 characteristics is what I'm sure we'd all recognise, certainly I would recognise as good public health practice. What do you need to do that? Well, you need data, you need testing, and again, we've all got different access to data and different access to testing. So some kind of consistency around our testing regimes, I think, would be good. I'm particularly nervous at the moment around for the PCR test, the false positivity rate in testing asymptomatic individuals in low prevalence countries. So again, we seem to be in a race to the bottom going, it's about instance rates, it's about testing rates, whereas actually there is no one indicator. It is that kind of nuanced balance about what we would recognize as good international practice to achieve a common picture. I was just watching a UK news story about the quarantine in France, and I think a government minister referred to an inexact science, and it's a phrase I've used before in relation to the Leicester and Leicestershire lockdown, and actually I think it does us a disservice. It's not that it's an inexact science, it's a complicated science. And we do try and need to put across a better narrative about the interplay between rising numbers in a particular area in a very short space of time versus underlying prevalence and sort of 7-day, 14-day instance figures, plus all the testing numbers. So we probably need to explore, I would suggest, David, anyway, that there's something about the detail of a common narrative around what makes a good surveillance routine, which then enables local people to do the detectoring, which I think is absolutely key. And then, of course, internationally, I'm sure there's a huge number of local practitioners around the globe that are seeking to do this, but are then stymied by government policies which take a blunt hammer to an issue, and a quarantine on an individual country would be one example. But equally, I think it plays into lay knowledge is important, but there is something about maybe challenging some of the assumptions around risk and spread and the evidence around that, which I think does us a disservice. And clearly from a UK point of view, take schools reopening, there is a sort of clamour in the media for broad brush actions which are seen to happen somewhere else and therefore must be seen as being a good thing, whereas actually they need to be appropriate to local circumstances. So in our case, my big issue would be potential spread from Leicester City, which is a high incidence city within the UK, into the surrounding area, which is my patch. And that's largely driven really by workers who travel out to the city and work in big manufacturing plants in the county. So my issue isn't necessarily with widespread community transmission. It is about understanding the right measures for that particular setting, instead of what happened with the UK government is blanketing the entire area with a local lockdown. So there's almost kind of wanting to dig into the detail of the characteristics and maybe share some thinking around what internationally would look like a good way of joining up the dots around the detectoring, which is really key. And let's face it, it's what we're trained to do, it's what I like doing. So self-interest in that as well.
So this is our epidemiological detective, Dr. Mike Sanders, who's Director of Public Health in Leicestershire in the UK, and reminding us that life is really this terrible interplay, and it is terrible, between top-down blanket policies and bottom-up local knitting together. And what you really need is both, but often it turns out to be conflictual. And I think, Mike, you've really put it nicely, because what we all need to do is to be encouraging that delicacy of operation that works in between what the top says and what's happening at the local level, and getting it so that it is adapted to the local circumstance. Thank you for sparing the time to share things with us so openly in that way. And so we go to Holly Wheeler. Holly, I can't see where you are, but it will come up if you click your video on. Yeah, there you are. And Holly, you've been away, come in on this issue quite precisely, but you've got a particular point you want to raise.
Yeah, so the thing, it's very related to what Mike was saying, actually, in terms of information and access to information. So I think one of the things that I notice is very difficult for local people to do, and even individuals to do, is make an assessment about what the risk really is to them and to the people around them, and the consequences for not just themselves but their local communities about the actions that they take. And how do we encourage both the people with the information to share it, release it, but also for the people taking in the information and the people using the information, like the media, to do it in a way that's responsible and educated, because there's some of the things that we're talking about are very complicated and nuanced. And so helping, I think one of the things that leaders should be doing is helping people have conversations that are rich and textured, not short snapshots and sound bites. And I wondered if people have had experiences of that, and what things really help those conditions to be able to have more self-responsibility and more releasing of information in detailed, kind of nuanced conversations. So.
Thank you very much indeed, Holly. You see, it's really fitting in to a sort of pattern of discussion here. The information has to be sufficiently detailed so that the detective can reach some kind of hypothesis about what's going on. But it is complicated, and simply just looking at the trends in numbers of cases isn't good enough. And yet at the same time, it's the trends in numbers of cases that is often reported and forming the headlines. And in fact, if a local community shows an increase in numbers of cases and then acts on it, that's a very good thing. But they mustn't then get punished. And so if you then get, as a result of information about an increase in numbers of cases in an area, suddenly there is a major reaction that is seen to be a punishment reaction, that too gets very difficult. And so, as Holly says, it's creating the conditions for textured conversations. I love the way in which that phrase emerged. And if you don't mind, Holly, I'd like to expropriate it. And then what Mike was saying about, if you're going to make a decision about what to do, you've got to base it on what's happening in the setting, rather than having some blanket set of rules. So do schools stay open or not in the area? Well, you need to understand what the population movements and connections are, and then make the judgment based on what you're seeing there. Again, textured conversations and understanding the connections between people. So thank you very much, both Mike and Holly. Now, NK Sudha, where are you calling in from? NK Sudha. There you are. Would you like to unmute, NK? If you can unmute from where you are, Sudha's iPad, or if it's us controlling the mute, he says he can't unmute. Let's see if we can unmute you. If you come, yeah. Just let us, where are you and what did you have in mind? You're live, you're working.
Well, right now I'm in India. No, not working, doing independent pro bono work, that's all. And doing something which may be of a good cause for the country and maybe worldwide.
Yeah. And where are you, NK?
I'm currently based in New Delhi.
Yeah. And you,
And
what was your suggestion that you put in the chat for us today?
whatever you have indicated is absolutely the things which need to be done. But what I have observed, the dashboards which appear on the television, which appear in media, which appear maybe certain charts which appear in the newspaper, at times project a lopsided picture, and many a times it reflects an official version where, to whatever reasons it is, they say that we are doing better than this country, we are doing better than that country, based on selectively chosen indicators at different points of time. And you rightly said, simply number of cases is not important. At times they say we are double than others. At times they say that the rate of increase is slower than others. At times they say that the death fatality rate is lower than others. But they never give a holistic picture where we still need to do better. By projecting a lopsided picture, what's that the people become complicit. And in order to ensure proper community participation, and as you said, people are the prime or of prime importance. And in case we need to seek their cooperation, they need to be given a right kind of a picture, saying that yes, we are doing better than on these aspects, but on these aspects we are not so, and we need your help, and we need everybody to respond. And I have even talked to certain people who are learned people, but they are not too conversant with the terminologies. And they think that we are doing better. Maybe doing better on certain aspects, but not on other aspects. That's the point.
Yeah.
How do we go about addressing this challenge, that a clear picture is presented, not to scare, but at the same time, not to make people complicit?
Good. I think that this is really important. And one of the things that I love it for all of us to work on is thinking through what are the kind of dashboards or indicator lists or information packages that really are needed by people to make sense of this and to make the kind of choices that are helpful. And NK, I think that there are big challenges with the way in which news tends to work. Sometimes there's not a lot of tolerance for leaving space for the proper discussion of this information. And I'm very grateful to you for making that point, and we'll try to maintain a connection with you as well as I'm doing with colleagues in India on what are the pieces of information that will help with decision making. Let me move to Marianne Hazelgrave. Marianne, you wanted to pick up on schools, and you and I have had a discussion a bit about schools before, and you've got some questions about schools. And if you'd like to make your point, and then I'll perhaps make one quick remark in relation to that. Marianne, please.
Yes, if you look at, well, you can't see the chat, but I've been having a lot of good information coming from Catherine on this. This is really a very serious problem. Children have been out of school now for months, and it's a question, it's another aspect of lack of global leadership. And my question, and Catherine has come back on it, is to what extent is UNESCO doing what it should be on it? And she said there was a webinar in April. Now we're in August, and there's so little guidance and information, and we're messing about with children's lives. And I think we have to take it very seriously.
And after Tuesday, actually, we did decide it. Catherine, do you want to just say a couple of words about where you think the school's work has to go, recognizing that we're not in positions where you can press a button and make things happen, but we can certainly advocate for it. Catherine, please.
I actually was really impressed, and I know you've mentioned it on these and other fora before, but I was really impressed with the WHO take from Mike Ryan that schools can't be treated as isolated units. They have to be considered in the context of the community they're in. So the precautions taken to manage school opening or management need to be designed for the amount of virus that is in the community that they're in and serving. And I think that the upside of that is that it can help direct people to, for instance, levels. Should the school open? Should it not open? If it opens, what kind of precautions it should take? I think the downside is that it also means that each school and each district is sort of on their own to make these decisions. And I think the hardest thing to do is to give people the kind of support and guidance that they need to make really hard risk assessments and evaluations and decisions after that. I hope that's helpful. It's not as pointed as it might have been.
So I'll go to Mike. Mike, how are you talking to the school leaders in Leicestershire? Are you finding that the relationship is good? Are people understanding this need that you can't just treat all schools the same? You have to put them in their local context?
Yeah, funnily enough, I was doing a briefing with the Leicestershire head teachers yesterday, and I've got another one at 10 a.m. this morning with special schools. I suppose key points for me are, again, they really appreciate local context and somebody local that can take them through what the picture of infection looks like in their local area. That's really gone down well. That mitigates what is perceived as a lack of clear direction from government. So in the UK case, the Department of Education, where the guidance is seen as being late and not clear. So local context is everything. And then the other key one for me is the ability to then talk to them around the edges, because as I was saying to them yesterday, I think people, parents and teachers get the guidance and the need to socially distance and observe good hand hygiene when they're in formal settings. So, queuing for shops or in a lecture environment. But it's the human behaviors around the informal settings. So parents at the school gate collecting their children, that's where we start seeing, the social distancing breakdown. So actually talking to head teachers almost around the nuance of human behavior rather than just the formal precautions they need to take or the dashboard has been a really, really good thing, which they seem to appreciate. I've done that a few times now, and it's gone down very well to establish the local links.
Very good. Thank you very much indeed. And just, I'm so pleased because what Mike has said is said much more clearly than I could say it, is what, of course, we need to do. Catherine, it fits with what you said. And Marianne, we are going to have to work on this in a way that empowers teachers to make the best possible decisions working with the local communities. And that's what Mike Ryan of WHO is asking us to do. But we've got to work harder at it. We're going to keep schools as a constant issue in these briefings. So grateful to you for bringing it up. I'd like to invite one or two people just to give 1 minute check-in remarks. We haven't been connected to you for 4 weeks, and it's just lovely to see you back with us. Could I go to Joseph Batak? Joseph in Manila, how are you and how are things where you are? If you want to, you could just give us a minute. It's up to you. I was going to go to Ronnie Waldman, who hasn't been on one of these before, who worked with me on pandemic preparedness in 2005 onwards and has been a colleague of mine over the years. He's been in the US, he's been in Scandinavia and Portugal, and he's managed somehow to move around. If he wants to give 1 minute of check-in, that would be fine. I don't know whether you want to, Ronnie. And I just want to greet my daughter, Polly, whose husband's a head teacher at a nearby school and is actually dealing with the issues that Mike and Catherine were discussing real time, and just want to say how great it is to see you, Polly. Also greetings to Louisa Nofke. Thank you for being with us. To Anne Van Bolwis, to Sarah Phillips, to Tracy in Vancouver. Thanks again for joining. And also I wanted to say hello to Godfrey, who has just disappeared, but I saw you just now, Godfrey. There you are. Yes, I've seen you again. So anyway, if you do want to come in and just say anything, hello, Polly, good to see you. Fruzan, it's nice to see you. Not quite sure how your camera's doing, but I can see your name there. And let's now go to Annie Feltham. Annie has been with us on several of these, and we have discussed the fact that we are not penetrating with the approach that we're trying to use, with the political impact that we want to have. We've got a public, according to Annie, that is feeling quite disconnected from the issues. Annie, do you want to just come in? Because we're going to have to get politically smarter. We haven't, you know, we're really racing against time, given the way in which the pandemic is expanding. Global leadership is a bit lost. Do you want to make any comment at all from your political perspective on what you would like to see us doing more of? Over to you, Annie.
Thanks, David. Welcome, everybody. I smiled at your local response guidelines, excuse me, the 5 issues, because they can almost be guidelines for political life about bringing everybody together. And even with, and I was interested to hear what you were doing in Leicestershire, Mike, even with a supposedly well-informed, well-articulated, educated society that we're supposed to have, our messaging is not working. And so we have to somehow fight through the avalanche of different requirements, requests, commentary from national government to make sense locally, because it changes all the time. And I was really interested in your conversation that you had on the Jeremy Vine show, which is how do I describe that to everybody? It's a fairly right-wing commentary, but it has a very big audience. And so somehow or other, it is this issue of bringing people together and almost fighting through the politics, which is extremely difficult. I mean, even at a local level, where we are working hard at this, it is hard. And so I think we have a really good conversation amongst ourselves, and it's getting these messages out in a way that engages with people, rather than stigmatizes them or pities them, or all of the sort of more negative ways of talking to our population, which quite frankly are hardwired into the undemocratic parts of British culture. But you know, I'm sure there's sort of generalizable lessons there, and I think it's listening to you all that's what I'm learning.
We're going to do that, and that's going to be a real focus. I'm just going to give a couple of minutes to other people before we close, but what you've just said, Annie, is really important, and it fits with what Mike said. It fits with what we heard at the beginning also from Holly, and we are going to make a point of encouraging this way of working. But Loy, you were going to talk, and I did want to give you a couple of minutes. Off you go. I'll have to unmute you. I don't know how we do that. Let's just see. Can you unmute yourself, or is it our end?
Unmute myself. Okay. Okay. No, I said that I'm based in Egypt, but I am also keeping active touch with India. So those Indians who are on the call, as well as those of you who are interested in India, happy to link up with some of the official agencies and the NGOs and corporates who are working on it. Do have a look at a series of interesting booklets that NDMA has brought out in collaboration with CDRI, Coalition for Disaster Resilient Infrastructure. And I can imagine you may be critical of some of it, but it's good to see that they are engaging at the subnational level, and let's tackle that. The third thing I've suggested somewhere in this chat box is that we form a small group which communicates over email. And perhaps that is a suggestion. We can put some restrictions on it, that we are not all over the place, but it may be useful rather than only communicating over chat and then not having a record of it. So these are some stray thoughts. I think this is really useful. Thank you.
Lloyd, they're not stray thoughts. They're the step. We find we've got some common issues, and then we work out how to deal with it. And I will ask Twee to just indicate quickly, Twee, how would you like us to react to Lloyd's suggestion?
On connecting, I'm going to do a little bit more research, Lois, so thank you for the suggestion. We have to find something that's easy to use, but also is a secure, safe space for us to share information. And perhaps I can engage with you separately on that.
Okay.
I think Kadea is on the call somewhere, or she was. She's from New Zealand and she's been keeping in close contact with us. She's also had a baby during a few months while we've been doing these calls. Just wanted to say hello to Anna Main is on, or was on, and also from New Zealand. And so just wonderful to have Kiwis here. I was looking at Helen C and wondering whether the Helen C is from New Zealand as well, but you never know. Very nice of those of you who've joined from very different parts of the world. I was mentioning Ronnie Waldman, and he hasn't unmuted and said hello. So I'm assuming that he doesn't want to say anything, but there is a small group of people.
So I'm happy to say hello to everyone. Thank you, David, and thank you for having me. It's a pleasure to meet everyone.
Yeah, and Ronnie is an expert in pandemic preparedness and worked with me on this in 2005. And is watching with some disbelief as what's happening. Ronnie, last 30 seconds from you, just any quick reflections before we close.
Just one reflection then, because, hello everyone, because you said that I had been moving around, and in fact I have been somehow. I've just been very, very surprised at the 3 different places I've been and how different the flavor is from the part of how people, from that perspective of how people are experiencing the pandemic and what they're doing to protect themselves. I think people are aware of the situation in the US where everything has become a matter of politics, of choosing sides. If one says yes, the other says no, and vice versa. A very contentious attitude, and almost a quite immature playground-like way of dealing with the situation. In Sweden, I found things to be quite different. You're all aware of the different path that Sweden has taken. They did not handle the beginning of the outbreak very well and had a substantial number of excess deaths, particularly in the elderly and in chronic care facilities. People are going about their business. The pandemic does not seem to have affected life very much, at least not now during the summer. I was just absolutely amazed at the fact that no one wears a mask anywhere, including in crowded indoor places. There's no attempt to distance. People just go about their business. In fact, when I arrived from the US, I thought I would be responsible and wear a mask, and I was walking with my wife in a crowded area, and people were telling her behind my back how wrong they thought it was for me to be wearing a mask, and that all it was doing was scaring people into feeling that they were behaving wrongly. So, I mean, I'm happy that my wife defended me, but I found that to be very strange. In fact, though, they have very few cases now and almost no deaths occurring. So they feel they're very, I'm going to finish up with a unifying point. I just want to say in Portugal, the situation is quite different. They've also done a good job recently in controlling the outbreak. Very few cases and deaths, especially where I am. But here is the opposite of Sweden. Everyone is complying with the government's recommendations. And I think that's the unifying point I wanted to make, is that where I've been, it seems to be a question of how much trust people have in government, both national and in local leadership, where people are happy with the leaders that they have elected, that they have selected, that they are behaving much more responsible and much more like adults. That's what you hear a lot of in Sweden, that the government has trusted us, trusted the people, and felt that we would behave like responsible adults, and we have and we are. So they seem to be getting away with it. this issue of government leadership, I think David has mentioned that I have been involved in pandemic preparedness for some time. All of the predictions as to which countries would fare best have proven to be wrong. And I think the reason for that is that most of the models looked exclusively at how strong the health system was, how well people, how much access people had to routine services and other just gross indicators of how well the health system performed. But there was not much consideration given to the context in which that health system was situated, the overall political environment, the governance of a country, the social contract that had been established between the government and its population. And we just see now how incredibly important that overall leadership from the government, or lack of it, is having an impact on the way the pandemic is playing out in an individual country and even at subnational level. So I just wanted to leave it there and maybe expand our thinking a little bit. David knows well the phrase that maybe he came up with, but that we used always, was that these exceptional health events are not confined to the health sectors. They're really whole of society events. And unless we take all of that into consideration, we're not going to do well with it. Over.
Thank you very much indeed, Ronnie. That's a really nice point for us to leave on: people trusting in government, government trusting in people. With that, we break, and we'll be reconnected again, if you want to, next Tuesday at 5 p.m. European. Thank you so much for joining. Bye-bye, everybody. Bye-bye. Thank you.